EGM Network.
Treasure Coast Connector. Connecting residents and businesses of the Treasure Coast. And here's your host, Ellen Contreras.
Welcome to Treasure Coast Connector. I'm your host, Ellen Contreras, and this episode is partially sponsored by Libby Weissman and her team at Senior Transition Navigator and Luxury Homes of the Treasure Coast. They work with seniors and their families to help with transitions, and they provide services like downsizing, decluttering, packing, moving, relocation, and more. You can get a free consultation by reaching out to Libby at 772-783-2800 or visit seniortransitionnavigator.com or luxuryhomesofthetreasurecoast.com. Now, health insurance, we all need it, yet we hope we don't have to use it. And getting the right coverage is confusing, especially for seniors, because there are so many options. And wouldn't it be wonderful if we had a person dedicated to us that can answer our questions, cut through that nonsense, give us good explanations, and even better, advocate for us when we have questions that need answering. So now joining me in the studio today are two experts. I have Diane Wyland and I have Matt Clark of Senior Solutions Insurance Agency. They have a lot of great information to share. So welcome to the show.
Thank you so much, Ellen.
Thanks so much for having us.
Yes, I'm very happy to have you here. We'll get into a discussion as to why, because not case studies, but testimonials, right? Case studies are great. Testimonials are fabulous. I got one for you, Diane, okay? But before we start talking about Medicare and health insurance and all of that you provide, we're going to start first with Diane, because she's a lady, if that's okay.
Absolutely. I would hope so.
Very good.
That's how I was raised.
Excellent. Well, thank you. So now, before, again, we start talking about insurance, what made you want to become an agent and even work in this industry?
Well, I was actually helping my mom way before I was a health insurance agent, before I even knew what Medicare was. And she had original Medicare and VA benefits, and she had an emergency and ended up with all these bills. And I'm like, don't you have Medicare, Mom? And I mean, she had bills up the wazoo, and it's like, oh my goodness. And so we got her a Medicare Advantage plan. And by the way, we did get the VA to pay for that emergency. They didn't want to, but you fill out the proper forms, and they do, even after they deny it, and you send them the right forms again. Yeah. And so that kind of started me on the trek to becoming a health insurance agent, and so I understand a whole bunch of.
Well, you are a walking encyclopedia. I'm just going to say that Diane knows everything, and I've only just met you, but through Diane, I understand that you also know everything there is to know about health insurance. How does that feel? Am I putting you on the spot?
I don't know if I know everything, but I know enough to be dangerous in the game, so to speak.
Right.
And always trying to help people, because that's the purpose. So.
And you are third generation, because your father founded Senior Solutions Insurance Agency. So now, what made you want to join this, and better yet, what made you and your dad want to open up your own agency?
Yeah, absolutely. So from two perspectives. So my folks are divorced, but my dad and my grandfather after Vietnam became a licensed agent for Mutual of Omaha, who we've all probably heard of.
Oh, yeah.
And he passed kind of shortly after the war and a few things like that. Fast forward a number of years later, my dad got into the business as well. And the whole reason, he had started with Mutual of Omaha as a captive agent, but he was finding out as time went further and further along that being able to just offer one insurance carrier may not be what's actually best for the person he was sitting down in front of. So that's when he became independent and started that. And then in terms of from my mom's end, I was a part-time caretaker for my peppy. So right around 15 years old, I started just helping my grandparents on my mom's side just with everything, going to the doctor's appointments, shaving Pepe because he started to become blind and that sort of thing.
Yeah.
So those interactions, and then I would be a part of like, hey, this bill came in. Not that you're 15 and you know anything, but you just catch wind of it, you hear about it, and those little things. As I was watching them get older and older, it became more and more confusing to manage it.
Oh, yes.
And I would start to do it, and then eventually, fast forward after college, my dad was like, you really should get into the family agency because you want to help people. This is an opportunity to do it. It might not be what you think. And I was like, okay, maybe you're right. And so now here we are. I'm sitting with you guys and hopefully helping people.
No, that is wonderful. And so when you mentioned about it being confusing as we get older, this is a great segue because, yes, as we get older, there's just a lot to know. And then I heard through several people and then what is on the news that there's been some changes to Medicare and insurance coverages, but then they said, but just wait, there's more stuff coming. So what would you like to share about that, and what would you advise seniors with all of these options and changes?
Yeah, so there's always a lot of changes. So it's a multi-pronged approach because people are going to inevitably get older. Most of the time when someone's getting older, generally speaking, their health will decline, not generally improve. So you have it from that perspective, meaning at 65, they're taking one medication. At 85, they're taking 5 or 6. So there's that. And then Social Security and Medicare are the two largest government expenditures. So there are changes that occur naturally through that process, right?
Yeah.
And then this year, I'd say would you probably agree this year or from last year to this year, probably the most changes structurally, and a large part of that's been the Inflation Reduction Act under the previous administration got passed. Well, it went into effect January 1st of this year, which puts a $2,000 cap on prescription medications. So that should be a positive.
So that is a good thing. Yeah.
Yep, that should be a positive for most seniors. There's also the opportunity now where people can enter into it's called an MPPP, Medicare Prescription Payment Plan. And that's really set up for an individual. Maybe they get an expensive medication and their costs are like the deductible and copay. So that first pickup in the year could be $700. That's an absorbent amount for a lot of folks, especially if they're on a fixed income. And now what you can do is actually enter a payment plan and break that down a little bit easier. So instead of $700 up front, you can break that up over payments.
Okay.
So some changes there.
So what would you like to add to that? Like, I know Diane is thinking, I know her. She's our friend. She's like, where do I start?
That's the big thunder.
That's the big one,
yeah.
I mean, obviously that people are hearing about potential things coming up, proving your identity, things like that. My response to that is, if you have to, deal with it when it comes.
Okay.
If it's something online, and frankly, if you're my client, I'll help you with it.
See, that's what I want to hear.
Yeah.
To not necessarily worry about all of these changes.
Yeah, don't worry about it till it comes.
Because they have, as long as the people that are listening and watching have you guys,
absolutely,
then they have less to worry about because you're going to walk them through all of these changes.
Yeah, we'll walk you through it. None of these changes are meant to harm us. They're going to be, I'm sorry, if you're 200 years old, getting some Social Security, expect to have to prove yourself.
Okay.
I'm just saying.
That was a little sarcastic, but I got that. You are the queen of that, but very good. No, but that is understandable. And so also what I mentioned, in the intro is that, and you even mentioned it with medications, a lot of us have a set it and forget it when we have insurance or our Wi-Fi bills, just those everyday little, bills that come in. You set something up, you're like, great. So my husband and I were not really paying attention. And then Diane said, would you like me to come over? Yes, please. Right? So you went over all of Omar's coverages. His Part D for prescription, she showed him, and this is the nice thing about Diane. Diane will look at everything and she'll either say, you're good the way you are and tell you why, okay? Or this is something better for you and why. So the Part D for 2025, the savings for my husband is just over $1,000. And he was so happy. He wanted to kiss Diane. He's going to feed her a very nice dinner. And then Cindy, he said the extra money, he's going to buy me a diamond.
Wow. That's wonderful.
I picked up the cat.
He didn't say that.
Instead.
Now remember, that's when you work with us, and I know with Diane, she saved you $1,000 this year.
Right.
You know, we think about retirement as 20 to 25 years long. Just that one interaction, and having that trust and that sort of thing. Yeah. My goodness, I mean, you can extrapolate that. That could have been over $10,000 by that one meeting.
Yeah, and you never know going forward. There might be some changes where maybe he has to pay a little bit more, and that's okay.
Yeah.
It was just so nice to have that. And we have a studio audience. Actually, I would love an actual studio audience, but Cindy, the show producer, she wants to talk about switching Advantage and traditional Medicare plans. So let's talk about that
We
a
can
little
definitely
bit.
talk about that.
Yeah. My husband has a supplement.
Nice.
And we're going to stick with that because we feel for us that's the best way to go.
Absolutely.
But what would you like to talk about the Advantage and traditional Medicare?
So it's possible to, usually it's during the annual enrollment period, which is October 15th through December 7th every single year for those with Medicare. You can switch from a Medicare supplement to a Medicare Advantage plan. Always talk to your advisor about that because it may or may not be advisable to do it. But if you're going to, that's the direction that you can always move. Okay. It requires no underwriting to change in that direction. You cannot always move from the Advantage to the supplement. If you're moving that direction, it almost always requires underwriting. Okay. There are times that it doesn't. Sometimes it's guaranteed issue. But usually it requires underwriting. That means medical questions. So if you have some medical issues, you might not be able to. Sometimes there's height and weight requirements. So it just depends. Talk to your advisor about that.
Yeah. So you know what I'm looking at? I'm looking at the time. And it's time for a break. Cindy is about ready to chuck a shoe at my head. So we're not going to, no, she doesn't do that. But we have a lot more to discuss about Medicare insurance. So stay tuned. We'll be right back.
Evergreen Media is your go-to for podcasting. Business owners, boost your brand by educating clients with your own show. Just show up. We handle everything else. Get your custom video podcast on Facebook, YouTube, and more. Start today at egreenmedia.com.
What's on your list? Ice cream? Laughing so hard it hurts? The way the sun feels on your face? For one child, a simple list of brilliant things becomes a lifeline, a way to bring hope to his mother, and maybe to himself. Every brilliant thing is a funny, heartfelt journey through life's ups and downs, where you help tell the story. Now playing on the Waxlack stage at the beautiful Riverside Theater. Get your tickets now at the box office or riversidetheater.com.
At Sunshine Furniture, our 35,000 square foot showroom is filled with the largest selection of in-stock coastal furniture on the Treasure Coast. Dining and bedroom sets, occasional tables, sofas, sleeper sofas, love seats and chairs, and all the latest styles and colors from Tommy Bahama, Lexington, Hooker, Riverside, Universal Coastal Living, Four Seasons, Braxton Color, and Capri. We're also the outdoor furniture experts and have hundreds of styles of any patio furniture you need, including a gallery of Berlin Gardens and Pollywood. We specialize in fire pits, outdoor rugs, umbrellas, and replacement cushions. Right now, we're having a spring sale with lots of great markdowns and discounts on everything you need for your Florida home, including all pictures, lamps, and accessories half price. Sunshine Furniture, 1295 US 1 in the Publix Plaza, Vero Beach. Don't forget to visit our outlet store directly across the street, filled with lots of brand name closeouts and sale items. And visit our website at sunshinefurniturecasual.com.
Welcome back to Treasure Coast Connector. I'm your host, Ellen Contreras, and I am with Diane Wyland and Matt Clark of Senior Solutions Insurance Agency. And we're going to just dive right back into this whole open enrollment. So now, what would you like to share about open enrollment? Because, and again, there's another part to this question, is that sometimes people think, oh, I can't do anything because it's not open enrollment. So what can people do if they need insurance, and it's not open enrollment, because sometimes people think they have to wait, but they don't. So can you explain that whole thing?
Yeah, absolutely. So there's a number of different enrollment periods that can occur throughout the year. I would say, first and foremost, the most important for an individual is your initial enrollment period. So generally speaking, if you're new to Medicare, a lot of folks are signing up at 65. There are cases where you can defer your enrollment later if you're getting it through like an employer plan or something to that effect. But that initial entry into Medicare would be the most important time to probably sit with an advisor, so that you're getting explained all your options, okay? Because like we were talking before, the Medicare supplement at that initial window is guaranteed. So if someone does have health issues and did want that option, they should be presented it up front. The other part of it, and this varies a little bit by state, but in Florida where we are, the most advantageous time to get a supplement, generally speaking, is when you're 65. Cost-wise, it's the cheapest it's going to ever be. So 65 is going to be cheaper than 75 and so on. As far as the enrollment periods, January 1st to March 31st is an opportunity for anybody who made a change in the fall, which was October 15th to December 7th. That's an opportunity where they can make one change, either maybe go back to their original plan, they tried it out, they didn't like it, or something to that effect, or just change the plan. Those are for Advantage plans. If you have a Medicare supplement and you have original Medicare as the primary, theoretically, you could change that any time in the year. It is going to go through a process, though, because the insurance carrier at a certain point can do an underwriting like Diane went through. And then the most important for most people, because it's open to everybody, is the annual election period that takes place from October 15th through December 7th. You don't have to mark your calendars. If you just remember everything you hear on the radio or TV becomes Medicare, you'll know you're in that season because it's nonstop.
Yes.
Calls are probably coming through, your mailers, all that stuff.
Oh yeah, we get a ton of stuff.
Yeah.
And we ignore all of that stuff because the one thing for me is that I want a person. I have her cell phone number.
Yes.
Okay. And I'm sure that your clients have your cell phone number. So it is nice to not have to call an 800 number and never speak to the same person. You feel like you're explaining yourself over and over again. Diane has gotten to know us.
Yes.
Right. And so, and the retention for you is super high because you're so consultative. Yeah. And people really, they respect that about her, you know?
Course.
Yeah.
We're honored and grateful to have her a part of the family. So
Thank you. I'm so happy to be a part of the family.
Well, thank you.
Yeah.
Part of Senior Solutions Insurance Agency. I love being a part of it.
Well, thank you.
Well, that is wonderful. And then, so we were talking about, the setting it and forgetting it, right? But then when you figure out your coverages and now you're happy, right? My husband doesn't have to worry about bills coming in. Okay. But for the Advantage plans, yes, you're going to have some bills come in and that's fine. But when people are getting older, and like my mom, when she was dealing with cancer, she was scared. She wasn't thinking right. And she was so grateful that she had me and my brother. So what happens when bills come in and people are like, I think there's a mistake, I'm not sure. How do you guys handle it at your Senior Solution Insurance Agency?
You want me to start?
Yeah, you can start.
Yeah, so So contrary to popular belief, if you have even a Medicare supplement in your husband's case, theoretically, you still may get bills. Those are probably a mistake because he has a Medicare supplement plan G, but it can still happen. My mother-in-law,
it has a couple of times.
Yeah, my mother-in-law, we had to work to get her back about $100 because she was overcharged and it didn't hit the insurance. So it can happen to anybody theoretically. It certainly happens probably the most on Advantage because they're managed healthcare plans. But generally speaking, going back to the phone number, if you actually go to our website, my cell phone's on the front of the webpage. I'm sure my wife doesn't love that at times when we're getting married and stuff and someone calls.
Yeah.
And I have to send them an email that night once everyone's asleep. But yeah, if you get a bill that you really weren't anticipating or expecting, generally I just have somebody scan it over to me, take a picture with their cell phone, whatever is most convenient for somebody, drop it off the office. And we usually can work through it. If it ends up being a mistake, then we can absolutely help you get the money back through the proper channels.
Yeah.
But the point I would want to hit home is I feel like pretty notorious for providers to send you the bill before it runs through insurance. Because a lot of times I will get a bill from a client and it clearly shows the insurance has not yet paid its portion.
And they might not be aware of that.
No, and that's the biggest thing. I don't want to tell people not to pay the bill, but I would usually wait at least to the second one. Because you get that first bill and you're trying to be proper and do the right thing and pay. And lo and behold, it just never got sent through insurance or it's still pending. Each carrier has a different processing time.
Yeah.
Some are a little quicker than others.
And then they're kind of hoping, well, they paid it in full, so now we're not going to give them a refund or whatever. So that's annoying. But you know what I want to make sure we don't forget? We had a great conversation in the first half, is I want the two of you to share your contact information. So you go first.
Okay. My phone number, I'm Diane Wyland. My phone number is 772-559-1928.
But one more time, a little slower, because there's 34 people, Cindy said, they were trying to write it down that couldn't.
772-559-1928. You can call me or text me at that number. And you can also email me. I'm switching my email. My old email, starlight150dw@gmail.com, is still working. Or you can email me at my new one, Diane@wylandinsurance.com. Yes, I am part of Senior Solutions Insurance Agency.
Okay, very good.
Perfect.
And your contact information?
Yeah, everybody. Matt Clark, thanks again. My cell phone is 561-603-6130. You can also visit our website. It's seniorsolutionsinsuranceagency.com. Also, if you have trouble, getting in touch with Diane for email or something, all of her contacts also on the website too. So all the agents are on there.
Very good.
But yeah, call, text me is usually the best way to get a hold of me. You can go on the website and also book directly right there too.
Okay, so when in doubt, people should reach out and call. Okay?
Yes.
Because then you'll explain that maybe there's something that can be done right now.
Yes.
Maybe they have to wait for an enrollment period. But I just think that whenever there is a question, that they should just reach out and call you guys. Because then, even if they have to wait, you can actually get to know them, their history, their medications, all of that, and really put a plan together.
Exactly right.
Yes.
So it's never, they shouldn't wait to have that phone call at all. So, so Cindy is telling me that we have to wrap up the show. But as you can see, it goes by very fast because there is a lot, because this is a very emotional thing, because people don't understand insurance, right? They get a little confused, they get nervous, but I wanted everybody to get to know you because you're consultative. You actually want to understand your clients and how best to help them. So with that said, you are welcome to come back on again. We could actually drill down into a particular topic.
We'd
This
love
does
that.
not have to be a one and done. So I'm going to just look at this camera and say, my name is Ellen Contreras. I am the host of Treasure Coast Connector. And please reach out to Libby Weissman of SeniorTransitionNavigator.com and Luxury Homes of the TreasureCoast.com for help. And I hope everyone has a safe, productive, wonderful week. And until next week, I miss you already.